How are you? All right, this evening we are going to be talking about genomics, the quest for personalized care. My name is Sarah Tagender, National Sales Manager with nutraMetrix. And just to give you a brief background about our host this evening, which puts on this call, which is nutraMetrix Custom Health Solutions. Company is a complete suite of customized cutting-edge solutions, and we do this exclusively for health professionals. We give a wide variety of products and services, and our goal is to better serve patients, but at the same time generate some ancillary income for practices across the country. We give relevant information and training because it's an ever-changing healthcare industry. It started in 2014, and it has grown to a $40 million division. And our mission statement is that at nutraMetrix Custom Health Solutions, we believe patients should have access to recommendations for healthy living and products that promote optimal wellness from their trusted health professional. So therefore, everything we do is focused on helping health professionals implement customized wellness programs that benefit both the patients and the practice. We do this by providing our health professionals with science-based nutritional interventions, revolutionary technology, wellness-based education systems, and trained implementation consultants. nutraMetrix is changing the face of healthcare, one health professional and one patient at a time. This month, I am joined by Valerie Myers. Valerie is she has a master's in licensed, Valerie, you're gonna have to forgive me, licensed counseling. And if I mess this up, you'll have to help us out when you jump on. And Valerie is the owner of Child Mental Health and Child Mental Health Therapist at the Kids Therapy Center in Bismarck, North Dakota. I absolutely love talking to Valerie because I could listen to her all day long talk. So I hope you guys enjoy Valerie's accent as much as I do. Valerie Myers has been helping children and families for over 10 years now. And in her practice, she utilizes nutraMetrix and provides education on wellness-related issues that can positively impact children and their families' life. And, we have hope here with what we're doing with nutraMetrix and working in the field, where one of our products, or really our service, is our nutraMetrix Gene SNP DNA analysis. And we brought this in because, whether we want to call it personalized medicine, lifestyle medicine, there is hope that nutrigenomics is going to enable personalized dietary advice. It's still really at its infancy, and every single week new studies are coming out, but its contribution to public health over the next decade is going to be huge. That we know for sure as it continues to grow and get adopted by providers like Valerie Myers. It has been described as the influence of genetic variation on nutrition by correlating gene expression, or what we call our SNPs, so they're single nucleotide polymorphisms, with the nutrients absorption, metabolism, elimination, or biological effects. And nutrigenomics, we're aiming to develop rational means to optimize nutrition with respect to the patient's or client's genotype. And we're really at the beginning of this national trend, and there's only some practitioners who are early adopters to this exciting addition to clinical practice. Again, Valerie Myers is one of them. And so we're excited to hear her experience tonight. So Valerie, did you make it, and how bad did I mess up on your degree? Are you here with us?
Yes, I'm here.
Master's in licensed counseling, is that right?
Yeah, I'm a licensed professional clinical counselor.
Thank you. For anyone who has been following us or was on last month, I don't know if you guys know, but I had a baby a month ago. And so I don't know, is baby brain, I'm not sure if that hits some people genetically harder than others, but we were just talking about our kids before we hopped on the call. Valerie, when we had talked, I think back in January, and we talked about how a lot of practitioners have a very basic understanding of nutrigenomics, but it's been more prevalent in recent years. And, we hear about it. I know for me, when I just spent a lot of time at my OBGYN's office, I see a lot of advertisements for, whether it's the BRCA gene analysis or things part of prenatal care and doing genetic analysis before a baby's born. But there's kind of almost nothing you can do from a diet and lifestyle perspective if you test positive in those instances. And that's where I think that personalized genetics with personalized nutrition and lifestyle medicine is different. And some are even calling it actionable genetics. And many practitioners haven't been educated, but I remember you telling me back in January that this is something that you had been educated on. So where did you get this education? Where are you finding the latest genomic research?
Well, I mean, just like anybody else, my master's in counseling, of course, I got no genetic training in formal schooling, so I had to seek it elsewhere. So in the mental health world, we follow a lot of the neurological disorders such as autism and ADHD and stuff. And so in that training, they're starting to focus more and more on genetics, just like we're seeing in other fields, we're starting to see more and more genetics. So it is newer that we've been getting the education. So that's kind of where some of my formal education is coming from, is that just like everybody else, it's reading the research as it's coming off the press to try to stay up with what's going on and what's changing.
Is the research starting to come to you? Are there like certain people you're starting to follow on social media, or what, are you seeking this out? Are there courses? Are you starting to get credits for it, continuing ed credits?
Yeah, I follow a variety of autism groups. They focus on genetics, the MTHFR groups, such like that. Dr. Lynch, the Cleveland Clinic. I continually am following some people that are commonly posting about genetics and how the body's working and whatnot. But yeah, a lot of it is, really through Market America. As Dr. D finds something and she throws it out there, then I'm looking into that article and other articles that are related to it. Within the field,
right.
it is a hard topic. Yes.
It's so hard. Yeah, no, I know. And that's why I want to just start with this, because I think a lot of people are going to say, all right, let's get this information and let's see where it is. Or maybe they haven't heard of nutrigenomics yet. So Dr. Deidre Mason, who's our clinical director, and I are excited because we're doing a 5-city boot camp tour specifically on genetics and weight loss in clinical practice, separately and combined, weight loss and genetics. So not just together, so we're coming to your area, which is very exciting. So I know that you've invited a couple people, I'm sure, to this call. So we will be in the Bismarck area, but it's been challenging. A lot of practitioners, they say, I don't know where to find this. And so I do believe nutraMetrix is cutting edge. So it's good to hear, we're one of the places that you're looking for this information and to guide you with articles. Every scope of practice is going to have a different focus, and especially when it does come to genetics. A physical therapist might be interested in athletic performance, an obstetrician on fertility, bariatric surgeon on obesity. But when you're ordering a genetic test for a patient, are there certain genes, you just mentioned MTHFR, but are there certain genes that you have an interest in because of your scope of practice?
Yes, our Gene SNP is pretty amazing and fun to read for anybody in any way that they're looking at it, but specifically in the mental health field, there's about a dozen genes that I'm watching for, or genetic mutations within our SNP, because sometimes when I get a patient, it could look like one thing, but it could easily be another. And so that's what I like about the SNP, is that it can give me more clear guidance about it. But for example, some of the SNPs that I look at besides MTHFR, where they don't absorb their B vitamin properly, we commonly see that one in the autism, ADHD world those type of children. But if I get a child that comes into my clinic, and I'm saying children because I work primarily with children, but it can be for adults too. And so if I get a child that comes to me that is defiant and impulsive, and whatnot, they might have the label of ADHD and oppositional defiant disorder. But when I do the SNP, and it might come back, say BDNF, which is where they have a hard time learning from their mistakes typically. But say they come back COMT instead, and COMT we might see more with symptoms of an ADHD type child. But those specifics as a clinician give me better ideas of how I can best help turn down those expressions with our supplementation. So it can be very fun to be looking at these different SNPs to better help our patients in the mental health ward, particular in my area.
And it's been really exciting to have a test that is open for children. Were you doing genetic screening before you found this test that you could offer to kids?
I had somebody else do it. I wasn't the one doing it. But yes, but it wasn't as, I wouldn't say I couldn't see as many SNPs in one test. We just tested for MTHFR at the time. And that was pretty much it, so now I have a wide range of SNPs.
I'm sure
so I like this one
too. Having it in-house is nice, not sending it out. You could just make it really convenient for the patient. And we can do this right now, right?
Yes.
Do you find that then once you do this, do your patients' parents, does it spark their interest to look at their genetic code as well?
Yes, it does. Very much so. I have many families who decide to do the whole family, or the family members with symptoms in their family if they have something going on, just because they learn so much from the SNP.
Right.
It's very fun, that's for sure. I would say I've probably done just as many adults as I have children with the SNP already, just because word gets out and people are very interested in it. And we, in our wellness track in the clinic, which is the part that we work with diet, supplementation, and genetics, any age individual can come to us for that, those procedures.
I bet you're getting a lot of just notoriety through word of mouth. But when we talked last time, we were talking about a large hospital in your area that's doing genetic testing, and that patients have started to ask for it. And so I was just wondering, how is this gaining in the marketplace? Are clients asking for it, or how are you offering this test to clients? Are you packaging it with anything else, or is it just standalone? What's been your experience?
Yes. So we do have advertisement in our area from hospitals that do genetic testing, and with their testing, they advertise finding the right medications. And so people will ask about that, and we talk about how our test is not about finding the right medications, but finding the right wellness plan for them, such as diet and supplementation, to help turn down the gene expression. And that is more interesting to them because they would prefer to be medicine-free. Most people would be. So with it, yes, it's word of mouth, but I also do public speaking within the area. And so through that, within the clinic, we have a newsletter, and we have TVs in the clinic. We do the TLS classes in the clinic, or we have another class called the Natural Family Living class, and that is where we teach families to eat per basically their mental wellness. So it's TLS, and sometimes it'll be gluten and dairy free as well. But in that, we also talk about our genetic SNP that we can do. So there's a wide variety of ways that somebody could hear about this within the Bismarck area.
Because in the SNP that we have, it's 48 genes, and 22 of them are related to obesity. So there are a lot of obesity factors. So could you just expound upon a little bit more how this has helped these TLS classes? So TLS is nutraMetrix's weight management system that we have, and TLS Select is the track that we have for health professionals based on low glycemic impact eating, targeted supplementation, education, and moving your body mass. And so tell us a little bit about how the genetic test has helped enhance those results.
What's helpful about it is that it lays out the supplements that the patient will need or could use to benefit more. It also helps us lay out, when looking at those obesity index SNPs, to be more specific per that person. So it's very fun to see which ones might need green coffee or core if they have the LEP gene or whatnot, so that we can help them better to lose weight in a better way per their body, which is very fun because we have a lot of patients that, yes, they have weight management issues, but they've tried a lot of things and a lot of things haven't helped them. And so then they come to us so that we can test and not guess what's going on with their body to get them where they would like to be in a healthy state.
So nice, especially if you've tried other things in the past and they haven't worked. It can get frustrating to just try something else. It's so nice, and you can get right to exactly what's going to make a difference.
Right.
And I know you've made so many differences in so many families' lives that you've touched. And so how has this allowed you to personalize your care for your patients and differentiate yourself and your practice? And I don't know if you have any testimonials you'd like to share with us.
Yes, we have a lot of stories, and I look back at before the Gene SNP and how I practiced. I was your basic mental health counselor, and we do play therapy, art therapy, Santre work. I specialize in trauma, child abuse. And when I would get a child, especially with neurological difficulties, defiance and autism and ADHD, we use behavior modification and parenting skills, and most people would try to use medicine, and we would see that wouldn't help lots of times. And basically, as a clinician, you would try and you would give the skills to the parents, hoping that they could get their child on the right track. With the Gene SNP, we are now able to say, okay, this gene is expressing too high or too low, and we can help turn that down. And with that, we'll probably see some of these symptoms change. So, for example, and we can see this within the mental health world, such as far as depression and anxiety as well. I think of a 17-year-old boy that I saw last year, and he had came to me. He had battled depression most of his life and anxiety, and he had been institutionalized for his suicidal thinking and how severe his thoughts were. And, when he first came to me, he had started the product and he had started TLS and actually the rapid results, so he was going gluten-free and whatnot. And we did the SNP right away, and it takes 5 to 6 weeks to come back. And he was doing well, and lots of his mood had stabilized and his thinking had stabilized. And then when we got the SNP back, we realized a couple of different SNPs we needed to change. And basically, in the end, his serotonin levels were low, and so we upped it with core. And within it was probably 2 months, he really stabilized quite a bit. And this child wasn't even going to public school anymore because he was so feared to go out in public as well, and whatnot. He just could hardly stand his own mental health, basically. Well, so here we are now, a good year later, and he now is graduating from high school here shortly, and he has a job. And to think, his mom never thought that would have ever happened, at least not for years. And she hoped for graduating from school, let alone have a job as well, because we were able to stabilize his mental health. That's one. Some of the other ones that I get frequently are I get a lot of little kids, 4 or 5 years old, and they might be hyperactive and defiant, and they are getting kicked out of daycare and out of schools quickly and stuff. And in Bismarck, we don't have a lot of resources. So if your kid gets kicked out of daycare, parents have to stay home with them because we don't have specialized schools or daycares for them in our area. Anyway, so with it, a lot, when I would first get these kids, I might have said, okay, let's go gluten-free. and try to really focus on diet, because diet's huge in the mental health world. But lots of times we would still have some issues with defiance or whatnot. But the SNP allows me to look at, is it BDNF, MTHFR, COMT, or all of them? And when I can then take and say, okay, we're going to stabilize more with B and magnesium because of MTHFR and BDNF, then we can move the patient to a more stable lifestyle quicker, which has been really nice to be able to even have some ideas of where to go with goals with these patients, because sometimes we don't know. We just try to keep them safe or whatnot. And those are more major ones, but we also have the ones that are just more minor, like generalized anxiety, and here they have MTHFR, and they learn to live a non-toxic lifestyle, which we use Market America, SNAP, and other DNA line to help them live a non-toxic lifestyle, and then using TLS to be able to learn to eat properly and read labels properly and whatnot. We can help turn down some of these genes so that they aren't feeling anxious anymore or depressed anymore. So it's very fun. I always say, when somebody says to me, well, my dad or my grandfather is also anxious, so I just assume that I'll just always be anxious. And I'm like, no, we don't got to worry about that anymore. We can do so much nowadays with diet and lifestyle, and with the SNP, knowing which genes are turned up too high or too low. It's very fun.
Wow. That's incredible testimonials. And I've heard we've talked about these before, and they still touch me just as impactfully hearing this from you again. And I know, I've been watching you, Valerie, on Facebook, and I've tuned into some of your trainings and what you've been doing. I do think it is quite remarkable that, when we talk about personalized care and we look at, the scope of your practice and your clinic, that we're not just talking about, it's not about just a supplement and adding that. It's so much more. It's the whole lifestyle, the diet, the family dynamics, the non-toxic. I mean, I think that is just quite remarkable how far you take it. And that, it blows me away as someone also who, I've grown up with my dad, who is primary care. He's an OBGYN in a very busy private practice. And I know how, I've watched him in his office, how long he spends with each patient. You just don't have that kind of time. But it sounds like, you've been able to take all of nutraMetrix's tools and put them into such a value-packed care for your patients. And that is just so remarkable. And your patients, how are they responding to all this?
Very excited. They feel like they have hope. We get some of the hardest patients or some of the hardest kids, and they've seen, a variety of health professionals from the medical world, and we're never given any hope. And that's something that I hear continually from my families, is they feel like they have hope. They feel like they have steps that they can do to try to provide health for their family. And then when they receive results, they're just stunned by that it really is working. And I think that's the biggest, the best feeling ever, when you know that these families are now able to send their kids back to school, or just even go out shopping or out to eat or whatever. They can start doing regular family things again that they couldn't before because of mental health issues that were happening within their family. It's very fun to have in the clinic. And you're right, it's not just the genetics, it's not just the supplementation. We try to, I always say these are pieces of the puzzle. The testing is a piece of the puzzle. The supplementation is a piece. The diet is a piece. Being mindful and spiritual or healthy in a certain way is also a piece of the puzzle. So we do a variety of pieces of the puzzle, living a non-toxic life. So when somebody comes to me, no, it's not just going to be supplements. There's a variety of pieces of this puzzle to have a healthy lifestyle. And that's what's awesome about Market America is that I can use a variety of their products to help my patients be able to live this lifestyle.
We're so happy to continue to support you. And we always thank you for the support and the training that you've done. Because I mean, people have started to come to you and say, what are you doing? And so I don't know if you could just speak to, a lot of practitioners, they get excited about things and then they become really good at it within their own practice. But Valerie, you've taken time from your family, from your practice to go ahead and educate other practitioners about this. What makes nutraMetrix so different that you feel like you want to share and train other professionals with this brand and this company?
nutraMetrix allows us to duplicate pretty easily, right? So what I'm doing is not rocket science. Yes, I had to learn about genes. nutraMetrix provides education on the genes now, which is awesome. Even in the Gene SNP packet, the research is right there if you wanted to learn more about each of the SNPs that are right in our research. But, as a helping professional, I want my colleagues to be helping the way that I'm helping. I once was there where we didn't know what we were going to do with some of these patients, and this gives us direction for even our hardest patients. The education that we get from nutraMetrix is wonderful, and as far as the HP world that we get, and even in the product training, I would say that to understand just some of the basic things can help our patients in a variety of ways. When in my team now, I'd have to look how many counselors. I want to say 10 or 12 counselors just in my team that are on their way of providing very similar patient care or are already providing the same patient care as I am within North Dakota and Minnesota. So it's very fun to see more and more families helped at such a deep level.
And I thank you for sharing that and not just keeping. I work with a lot of practitioners and I meet a lot of practitioners in my line of business, and it always saddens me when people feel like there's, just not enough business to go around. I don't know. They don't want to share what they're doing, or they want to be the only one. And I love the environment that you've created where, we all should do it. Let's all continue to help people. There's enough people that need to be helped for sure.
Yes, that's for sure. It's like in Bismarck, we're a population of maybe 100,000, and just in Bismarck, I have 10 clinicians right there that are doing it. And it's not enough. It's like we all should be providing similar care. We want to help at a better level, and in the mental health world, there is enough to go around. Nobody should be having to battle severe mental health issues anymore. And I think that the Gene SNP gives us that opportunity to help these patients at a better level so that they can feel better and healthy for a longer period of time.
And we're just getting started. Just to reiterate, it is so new. Yeah. The research is so new. And I think as we continue to get people together to talk about this and to talk about actionable genetics, personalized care, biomedicine, whatever it is, I think we're just going to continue to elevate this conversation. And so I can't wait to come out to Bismarck next month and have these discussions with you and with the practitioners that you work with, and find out ways we can continue to provide, better tools and better resources. So I just want to end and just say, if anyone who is on this call has any additional questions about what nutraMetrix is doing in the field of nutrigenomics, you can email us at yourgenesnp that's SNP, at nutraMetrix.com, your Gene SNP at nutraMetrix.com. And GeneSNP.com is also a really great resource to read about some of these genes that Valerie Myers mentioned today, MTHFR, BDNF, COMT, some of the ones that she is using within her clinical practice, and the lens that nutraMetrix and Gene SNP DNA analysis looks at these genes. And, we're just continuing to roll out with more tools as the science continues to evolve, and as we see it gaining traction within clinical practices. nutraMetrix wants to be the partner for those clinicians to, like you said, it's a whole puzzle piece when it comes to genetics. I feel the same way from an implementation standpoint. There's a lot of moving parts, and we need to piece those all together to be able to, provide really great service for both patients and practitioners. And so then that way, practitioners can spend as much time with patients and their family as you do, Valerie, which I just think we need more of that in medicine. So I don't know if there's anything else you want to add for, someone, let's just end with this. For someone that is just looking at this for the first time, what do you think their first step should be when looking at a genetic product like DNA analysis?
I really like our website, GeneSNP.com. It really kind of gives that brief overview and positive feel about the product and how it works. Sometimes people hear the word genetics and they feel overwhelmed right away because they don't know what anything is like that. But to know that you can, this Gene SNP's laid out very easy for the average practitioner like myself to be able to analyze it and better help their patients. So I suggest to just become a little bit more educated, to step outside your box and be able to do it.
Thank you. That's where I send everyone to. So GeneSNP.com. All right. Well, I appreciate your time, Valerie Myers, and being on with us this evening. Again, I do this the third Thursday of every month live, but we also always try to capture the recording. And so if you are listening to this recorded, we hope that you go ahead and look for that information that we've provided. Go to the website. And of course, if you have any additional questions, talk to the person who sent you the link or invited you on this webinar today to listen to, because we want more people who want to help within this growing field. So thank you again to nutraMetrix for being the host of this call, and thank you for our guest this evening, Valerie Myers. My name is Sarah Tagenda, and I appreciate everyone's time tonight. Thanks again, Valerie.
Thank you.